Welcome to our lesson on nutrition and hydration. We'll go over what proper nutrition is, how to help our residents with a good balanced meal, good hydration, some special considerations to think of when we're assisting patients with their nutrition as well. So, nutrition is how the body uses food to maintain health. This is going to be especially important for our sick and our elderly patients. All right, so most of our patients are going to fall under one of those categories, if not both. So, what a well balanced diet is going to help with is it's going to help maintain muscle and skin tissues, as well as help prevent pressure injuries. A well balanced diet will also promote healing and health, so the healthy diet is going to help with the healing of the wounds and also cope with stress. Now, there are several different nutrients, but what you need to know about nutrients is that they are necessary substances that are going to help with a variety of things, from promoting energy, growth, and health, as well as regulating our metabolism and our hormones. So, the different type of nutrients we're going to cover are things like water, carbohydrates, proteins, fat, vitamins, and minerals. So obviously water is going to be the most essential nutrient for life. It's needed by every single cell in our body, and without it, we cannot live for more than a few days. Carbohydrates are going to help supply our body with energy and extra protein. They also are going to help provide fiber, which is going to be necessary for bowel elimination. Proteins are another nutrient, and this is going to be a part of every cell. These are going to be really important for tissue growth and repair, and they also do assist in supplying energy for the body. Fat is going to help us store energy. Vitamins are going to help with body function, and minerals are going to help with maintaining body functions, helping build our bones, making hormones, and also they help with blood formation. So Choose My Plate is a website that you can go to that will help individuals create a well balanced meal, and it gives education on good nutrition, how to create a well balanced plate for a meal. It even goes over things for like special considerations such as diabetes, heart failure, different common chronic illnesses people might suffer from. So this is a great resource for our patients and even for ourselves. Um, some of the things that it's going to go over are things like vegetables and fruit should make up half of a person's plate. We go out to eat, and if you think about a normal plate that we see at a restaurant, half the time, 50% of it's meat, and the other 25 to 50% is carbs. Definitely not fruits and vegetables. So, it's always a good thing to let our patients know, especially if they have questions about good nutrition. It's also going to talk about grains and protein and dairy. So, for example, when it comes to grains, a person should make half their grain intake whole grains. So, these are going to be things like whole wheat, rice, oats, cornmeal, barley, different things like that. Now, protein, we always want to encourage a variety of protein, and protein is going to be a huge part of the healing process, especially those people that have pressure ulcers or wounds that are healing. So different options or varieties of protein would be things like meat, poultry, seafood, beans, eggs, any type of soy product, peas, vegetarian meat substitutes, nuts, and seeds as well. When it comes to dairy, all milk products and foods are made from milk that retain their calcium content and are part of the dairy category. So this can be things like milk, is obviously a huge source of dairy, cheeses, things along those lines. In the healthcare setting, most times you're going to see a lot of patients are on what we call specialized diets. And what these special diets are they are therapeutic, they might be modified, and they're there to assist with making sure our patients are getting the proper nutrients that they need. They're not getting the stuff that may potentially harm them or hurt them more due to their medical condition. So, some examples of some specialized diets that you may see in the field are going to be things like a low sodium diet, which you might see as NAS, which means no added salt, or low NA. All right, so low salt. The reason they're going to have this is the salt restriction is due to harder kidney issues typically. There could be what you call a fluid restricted diet, or RF, and this is where we're going to restrict their fluids throughout the day, so we'll only allow them to have so many. And this is very similar to the salt, is it will be due to heart and kidney issues. Low protein diet could be due to kidney disease. A low fat diet would be due to heart or gallbladder disease. A modified calorie diet is for weight loss or to prevent weight gain. Diabetic diet are going to be things like calories, carbohydrates, protein, and fats are going to be regulated. Vegetarian diet are going to be for health issues such as diabetes or obesity, or it could be a choice. Liquid diet, now typically this is going to be a short term, and it's going to be due to some type of medical condition, medical test, or procedure. Soft or mechanical soft diet, this is going to be soft or chopped foods that are easier to chew and swallow. So the person might have difficulty chewing up foods to a safe size or consistency to swallow. Lastly is puree diet. That's where we actually blend their food, ground it into almost like a thick paste, and no chewing is required. It could be for a variety of reasons. Now, there are several other diets outside of these, but these are some of the most common ones that you will see. There will be times, however, when our patients are not able to swallow safely, and we may need to give them their nutrition through what we call a tube feeding. There are different types of tube feedings. There's a nasogastric tube, or what we call an NG tube, and that is inserted in through the nose and it's fed down into the stomach. We also have what we call a PEG tube, and this is placed directly into the stomach through the abdominal wall. It is surgically created, and we put that tube in there, and all their feedings will go through their PEG tube. There's a lot of different conditions or issues that may, or illnesses that may result in tubes being placed. Things like coma, cancer, stroke, if they're refusing to eat, extreme weakness, among many other things, may result in a tube being placed. Obviously, the goal of a tube feeding would always be that it would be temporary. However, it's going to depend solely on the circumstances of that individual, on how long they may or may not have to have that tube for. Some important considerations and special facts when dealing with somebody who is on a tube feeding. The head of the bed should always be elevated 30 degrees or more. And specifically, when they are actually being fed through their feeding tube, their bed should be elevated to, their head of the bed should be elevated to at least 45 degrees. And what this does is help prevent aspiration. Now, there may be times where you need to lay the patient flat to assist in rolling them or for various other reasons. If this is the case, what you want to make sure is that they're currently not being fed through their tube, so that is being paused if that needs to be done. As always, you should not be touching any machines unless you've received further training and been given permission. So you will want to notify your nurse to get the proper steps taken so it is safe to lay your patient flat if you need to, if they are on a tube feeding. Hydration is also a very important part of our patient's health and well-being. Water is an essential nutrient for life, and making sure our patients get the proper fluids is going to be extremely important. We can assist in doing this in several different ways. We can make sure we're encouraging our residents to drink fluids often. So every time we enter the room, we're encouraging them to hydrate themselves. Making sure we're being mindful, though, that some people are on food restrictions, or they may be what we call NPO, which means nothing by mouth. What the proper fluid intake is going to assist with, what hydration is going to assist with, is helping prevent constipation and urinary incontinence. Now, dehydration can occur when our patients are not getting enough water. And this is going to happen because they don't have enough fluid, and it's very common among the elderly. We also have to remember that there are some patients that aren't able to grab their cup and give themselves a drink. They rely solely on us to assist them with that. Sometimes for us, because when we're thirsty, we can just pick up a cup and drink it. We don't even think twice about it. It can be difficult for us to remember that we may have to assist or ask our patients if they'd like something to drink when we are in their room and assisting them. So make sure for those patients that cannot take a drink on their own that we're asking them often, we're going in their room often and encouraging them to take drinks and assisting them with taking a drink of their fluids. Now, hydration is important, but it is also very important that we do not have our patients go into fluid overload. And what this does is this occurs when the body cannot handle all the fluid that we've consumed. And it really typically is going to affect people with heart and kidney diseases. So some signs or symptoms that fluid overload could be affecting our patient would be things like edema. So remember, edema means swelling, weight gain, a decrease in the urine output. What we put in our body should be coming out. Shortness of breath, increased heart rate, anxiety, or if the skin appears tight, smooth, and shiny. Those are all red flags that our patient may be suffering from fluid overload. So we want to make sure that we're reporting that to the nurse and we're documenting that. Always remember our patients that are on fluid restrictions are on fluid restrictions because these things could potentially or have happened to them. So we really want to make sure we're following those fluid restrictions, and those people that are on fluid restrictions, we're looking for these different signs and symptoms because that is what likely will occur if they have too much or their body just can't handle even that little bit of fluid that they are in having. Some of your patients might have swallowing problems. Now, dysphagia is a word that we use often, and what this means is difficulty swallowing. We are typically going to see this in our patients that have had stroke, cancer, multiple sclerosis, or what we call MS, Parkinson's disease, Alzheimer's, trauma, among other things. When somebody has difficulty swallowing, we obviously have to be extremely careful in the food and fluids that we give them, and we need to make sure they're being safe. So, in order to make sure they're safe, there may be times where we have to thicken their liquids or their soft foods to help make swallowing easier. Now, usually when I say this, I get the why would we make it thicker? Wouldn't that make it harder for them to swallow? The easiest way for me to break this down for you is there's basically a muscle in the back of our throat, and it decides whether we're eating or drinking food or water or some type of liquid, or if we're breathing. That muscle becomes weak and it has a hard time differentiating between air and thin liquids like water. And so what that muscle might think to be air is actually water, and they send it to the lungs. And that's what we call aspiration. And it can cause infection, pneumonia, and even death. So when we thicken it up, it makes it easier for that muscle to say, oh, yep, this is supposed to go to the stomach, and it sends it to the right place. Now, obviously, that's a very simple description of what that does. There's a lot more to it, but hopefully that sort of helps you understand on why we thicken liquids or soft foods for our patients who do have dysphagia or difficulty swallowing. So when we're assisting somebody with food or we're observing them as they're eating, some symptoms or signs that they may be having difficulty swallowing are going to be if they're coughing during or after meals, they're choking during meals, maybe they're dribbling saliva, so they're sort of drooling a little bit, or food or fluid is coming out of their mouth and maybe they don't even realize it. They have food residue inside their mouth or cheeks during or after meals. So what this happens a lot of times is, especially for our stroke patients, is typically with a stroke, somebody becomes paralyzed or weak on one side of their body. So what will happen is they'll go to take a bite of food and say, for example, that the stroke has affected the right side of their body. The right side of their tongue and their mouth, most times they cannot chew or feel, for this example of a patient. So what they'll do is they'll swallow, and they'll swallow the food on the left side of their mouth, but they might have a huge ball of food left or even a small amount left on their affected side or their weak side that they don't realize. And they'll take another bite, and then that will build up, and they'll go to swallow everything at once, and they could choke on it. So that's what I mean. If they sort of have food left over after they swallow, that might be an indication. If they're avoiding eating, they're making a visible effort to swallow. When we take a drink of water or take a bite of food, it's a simple process. It's something that most people don't even realize we're taking a drink. But some people, when it's difficult, it's a big production almost that they're making this huge effort to swallow. If their eyes are watering when they're eating or drinking, or they're spitting out pieces of food, these are huge red flags that they're having difficulty, and it might be unsafe for them to eat alone. It might be unsafe for them to eat the type of consistency food or drink that they have, and we definitely want to make sure we're reporting this to the nurse and documenting it. When we have to thicken liquids for our patient, there are three types of thickened liquids that we typically use: nectar thick, honey thick, and pudding thick. Now, how we thicken liquids is a pretty simple process. Usually it comes in like a fine grain, like it sort of looks like a powdery substance that we add in. You just have to follow the directions on the packet, making sure you're producing the correct consistency that's needed for that patient. Where we would find if somebody needed thickened liquids would be in their care plan or their chart. Now we have the powder substance that we can use to thicken liquids, but there's also a gel-like substance that can go into liquids as well to thicken them. Once again, you should always follow directions. Now, in most places, the kitchen staff is going to be in charge of all of the thickening of liquids, and what that does is just sort of they only have to train one area on how to thicken liquids properly. It sort of takes away more room for error, obviously. But some facilities still have their CNAs or nurses do this, so it's just something that you'll have to follow your facility policies on. Make sure you're checking the thickness, that you have the correct thickness, you follow the directions correctly. So what a nectar thick consistency is like, it's going to be a little bit thicker than water, more like a thick juice or tomato juice type thickness. Honey thick is going to be the thickness of honey. So it will pour very slowly, and usually the patient or resident is going to have to use a spoon to consume it. Pudding thick is more of a semi-solid, much like what pudding is. A spoon should stand up straight in the glass when it is put into the middle of the drink. So those are the three different types of thickened liquids or consistencies that our patients will most likely be on if they're having difficulty swallowing. Aspiration is always a huge concern anytime somebody's eating or drinking. So what we want to make sure of is that we are doing things to help prevent aspiration from occurring. And remember, once again, aspiration means that our food or fluids go into the lungs instead of the stomach, basically. So what we can do to prevent this is make sure the resident is in a safe position. So that means that they're sitting upright as possible, typically a 90-degree angle for eating and drinking. We want to make sure when we're assisting them or we're encouraging them to eat that we are encouraging them to have small pieces of food or small spoonfuls of pureed food, making sure that it's not too much food in their mouth. Smaller pieces are going to be easier for them to chew and swallow. We want to make sure we're feeding them slowly, so taking your time, feeding them at their pace. Do not try to rush them. We want to make sure if they do have a weak side or an affected side that we are putting the food on the stronger side or the unaffected side of the mouth. We want to make sure the mouth is empty before offering another bite of food or drink. So make sure they've chewed and they've swallowed all of the food in their mouth before we offer another bite. And then for those that are at risk for aspiration, keeping them upright for at least 30 minutes after eating and drinking will be very beneficial for them as well. Now, when we're assisting with meals and snacks, there's a few key things that you need to be aware of. Now, when we're assisting, we're handing out food, we're assisting with meals and snacks, we're feeding somebody their meal. There's a lot of safety checks that need to go into this. We think feeding, all that, that we don't really have to worry about safety there, but we really do. So, first of all, typically speaking, anytime that a patient receives food, it will come with a meal ticket or a snack ticket. And what that ticket is going to contain are things like their name, their room number. It will have any allergies, it will have their diet, the consistency of their liquid. It will have things they maybe do like or don't like. It will have things that they always want. It depends on the ticket, but the main things that you should be looking at are the person's name, their room number, allergies, the consistency of their food, and the consistency of their liquid. So those are all huge safety things. Say somebody's allergic to nuts and we give them some food that has nuts in it, obviously that could cause death to our patient. So we always have to check that meal ticket or that snack ticket, making sure we check all of those items, making sure we give it to the correct patient and it's the correct items, making sure it's the correct consistency, there's no allergies, among other things. So that's going to be extremely important. So before you deliver a meal, this is something that you will be doing a lot of as a CNA. You're lifting up the cover to the meal to double check everything that's on that plate to make sure there's nothing that they're allergic to on the plate. And if you're unsure of what's on the plate or what's in the recipe, always ask the staff in the kitchen. They will have the ingredients that are in it. You'll also check the food consistency as you're looking at it. You'll look at the liquids on the plate to make sure they're the correct consistency, because all of that will be on their meal ticket, and it will also be in their chart when it comes to these important components. Now, a huge thing that I see a lot of mistakes in is giving the meal to the wrong patient, especially when there's two patients in one room. This is where making sure we're following our indirect care skills and we're identifying the patient and making sure we know exactly who we are assisting. Now, this is for patients that don't need assistance or need assistance with feeding. Either way, we always have to check all of these things. When we deliver the food to the patient, we always want to make sure they're in a safe, upright position, that we assist them in any way possible. Some people don't need assistance with the actual feeding part, but they may need assistance with cutting up food, with opening things like cans or condiment packets, sugar, salt, pepper, and different things of that nature. We also need to make sure that everything is within reach. I can't tell you how many times I've walked into a room, somebody's delivered food, and it's sitting off to the side where the patient can't even get to it. So they have this great smelling food, but they can't eat it. I can't imagine how frustrated I would be if I was in that situation. So making sure it's always within reach, we're talking to them, making sure they're in a safe position, we're giving them assistance with whatever they may need assistance with, and that can be as simple as asking them, "Do you need help cutting up the food?" Double check the meal ticket. A lot of times it will say cut into bite-sized pieces, so that way you know you have to do that if it isn't already cut up. But always ask your patient as well. When you leave things like cups and silverware within reach, if they have a weak side or an affected side, making sure you put everything on their unaffected or strong side. Making sure we're always encouraging them to eat a well-balanced meal, and making sure we're encouraging them to have their liquids so they're staying hydrated as well. One thing I wanted to follow up with a little bit more from the previous slide was allergies. Now, I know I talked about it a little bit, and I know allergies seem like common sense that we would double check the food, double check allergies of the patient before we give them anything. But unfortunately, it's something that I see missed way too often. Um, in fact, recently at a nursing home in the state of Michigan, a patient was given something they were allergic to because a CNA or staff member um, decided not to look at the meal ticket and look at the food. They decided to take a shortcut that affected the patient's safety, and they gave them food that they were allergic to. The patient went into anaphylactic shock. Now, anaphylactic shock means that the throat will begin to swell, the tongue will be able to begin to swell, and it will be difficult for them to breathe. They had to be rushed to the hospital, and thankfully they ended up surviving. But it is quite possible that they might not have, all because somebody decided to take a shortcut. This is why safety is always important, and looking at allergies is extremely important. We have to remember that the kitchen, the people that are building these meals, are sometimes building out 100 trays during each meal. That is a lot of trays, and obviously they are human beings just like us, and they are potentially going to make a mistake here and there. It is our job, we are the second line of defense for our patients before they get their food. It is our job to double check everything and make sure we're not giving them anything that could hurt them. So taking a shortcut when it comes to allergies is never the safe bet to go. I know it's a big thing, and most of you are probably like, I know this. Why are we still talking about it? However, sometimes it's the big things that we forget about, or what might be small on that meal ticket. It might be easy to, I don't need to worry about it. The kitchen did their job. It's important you look at allergies. We don't want to hurt our patients. Now, moving on. Feeding is something that obviously we are going to have to assist our patients with at times for those individuals that need it. It is also a skill that is going to be on the state exam. Now, in real life, you're going to be assisting patients with meals, snacks, and staying hydrated as often as they need it. All right. For the state exam, you will assist with a snack specifically. That's going to be something like Jell-O, pudding, or yogurt. Now, for the state exam, the patient is going to be in an improper position. So you are going to be in charge of making sure they get into a safe position before you start assisting them with any liquids or fluids or food. So what we're looking for is that they're sitting in an upright position, their head tilted up, looking directly at you. At the start of the state exam, they might be slumped over, their chin might be tucked down, they might be leaning back with their head tilted back. So make sure you get them in the safe position. That is going to be an important safety check for this skill. Now, we're always worried about when we wash our hands, but for this skill, not only do we have to wash our hands at the proper times, we also need to make sure we wash our patients' hands before we begin offering them food and water. Reason being, we wash our hands before we eat, we want to do the same for them. Offering water frequently is going to be extremely important. We should always offer before they start eating, every 2 to 3 bites during their snack or meal, and then offer again at the very end. They do not have to accept every time we offer fluids, but we need to at least ask and offer them before, every 2 to 3 bites, during, and then at the very end. Make sure we use a spoon when feeding, and this is sort of common sense for the state exam because you're going to be doing something like Jell-O, pudding, or yogurt. Typically, we usually use a spoon for those items. However, in real life, it's also important that you use a spoon. A fork could damage their mouth, could break teeth, chip tooth, or damage gums or any other part of the mouth. So always use a spoon when feeding. And in all honesty, the spoon's a little bit easier to keep food on anyways. When we are assisting a patient with their meal, we should be sitting when we feed them, making sure we're remaining at eye level with the patient. We're allowing them to chew and swallow before we offer another bite of food or drink. So being patient, going slowly, allowing them to chew and swallow, and then offering another food or bite. We always obviously want to make sure that we leave the patient's mouth clean and dry. So we're cleaning up the mouth afterwards, making sure it's nice and dry. And then we're going to record their their intake, how much they ate and how much they drank on the correct form. Now, when I go into assist somebody who needs to be fed, I typically don't say, I'm here to feed you. It sounds very downgrading to me. What I prefer my students to say, and what I prefer to say to myself, is I'm here to have lunch with you, or I'm here to assist you with lunch. Something along those lines. It just sounds less degrading. It sounds more respectful, like you're there to enjoy time with them. Now, I will add a video in here to go over the skill, exactly how it should look at the state exam, and go over some other things. One other thing I want to add that's not directly on this slide is that anytime we're assisting a patient with their food, we typically have a clothing protector over them. I have heard people in the past call them bibs, and we have to remember, out of respect and dignity, that we have to be careful with the words we choose. So bib would not be a correct word to use for a clothing protector. A clothing protector is what we call it for adults. And that is something that's going to go over their chest to protect their clothing while we're assisting them with their meal or snack. So, once again, please make sure we're thinking about respect and dignity when we're talking about certain items, and one of those being a clothing protector. That is going to sum up our lesson on nutrition and hydration. So please, if you have any questions, just shoot me an email at kfort at h2health.com. Thank you and have a great day.